Ladies and gentlemen, happy Monday. Welcome to another groundbreaking episode of the Know Your Pharmacist Livestream. I'm your host, Dr. Joaquin Acosta, the CEO of PharmTrue. Guys, today we're embarking on an extraordinary journey through the ever-evolving landscape of healthcare, technology, and human connection. So fasten those seatbelts. We're going to dive into the urgent need for at-home COVID tests. We'll take a look at that. Explore MIT's revolutionary wearable ultrasound scanner. Very cool. And then after that, we're going to unlock some of the secrets to student growth around the region, guys, and shout out in our community spotlight a little bit of that through there with some meaningful conversation there. So again, guys, let's go ahead and ignite our curiosity here. We're going to go ahead and also talk about a surprising study that actually shows how perhaps, cannabis may or may not be contributing to psychosis. So that's going to be interesting. And then we're going to look at the timeline that men should be looking at for evaluating their health over time, guys. So again, thank you to all of our trusted sponsors, PharmTrue, High Horse, the Trichome Alliance, and Vado Speedway Park. We are very, very happy and fortunate to have you guys and your support. So again, the Know Your Pharmacist live stream is ready to get going right now. So let's get this thing started, guys. This is exciting. Check this out. So basically, the state of Vermont, some pharmacies over there right now are currently running short on COVID tests. Something to keep in mind because we're about to get into that cold season right here in New Mexico, guys. We already know it's definitely, still 100 degrees. But I have some interesting data to share with you that definitely has not necessarily been, at the top of everybody's mind lately. And I understand that when it comes to COVID and everything. Anyways, the COVID cases over the last 8 weeks in New Mexico have been trending up. So check this out. Over the last 7 days, according to the Department of Health, the most recent one, even in August 4th, was 550 cases. The tests, we're still testing. I mean, in the state right now, about 4,300 tests that are getting registered out to the state. Those don't include at-home tests. So where you do think about that, I mean, at-home tests at least kind of clear you for, hey, should I go to work? Should I go to school, right? Or my other family members. And the cool thing about it was, is, at least in the state of New Mexico, at-home tests are covered by insurance, and you're allotted up to 8 per month, depending on the plan, may fluctuate. So, you could literally just go to pharmacies, get the at-home test covered from insurance, and, get them for free. Nice to have in the back stock. So where we're already seeing, hey, Vermont pharmacies with a report, out of last week, noticed a sharp increase in the number of tests and the people that have been coming in to buy, these at-home COVID tests. So basically, cases are rising on the east side of the country, and it's just something to keep in mind back over here in, our little neck of the woods, guys, because we're going to just get it as it gets a little colder, especially when the travel season starts hitting and everything like that. It may come even before that. I know the suggestion of the newer COVID variant and stuff like that is out there. We don't have a lot of data on that yet. However, what we do know is, back to school, strep throat cases are going to rise. Flu is going to start to rise. We're going to get into RSV, the trifecta season, flu, COVID, and RSV, and whatever other viral, illnesses come airborne or throughout, right? So to best be prepared, I think, being ahead of time, making sure that you're stocked at home with a couple tests, it's probably going to keep you guys going forward faster versus feeling, maybe achy and sniffly one day, not necessarily knowing if you may or may not have COVID. So we already know the case. We went through COVID 2.5 years ago, 3 years ago. We came out of it and we still have it existing. Granted, we are not in a pandemic status anymore, but it's something to just keep in mind, keep ahead of the game here for our neck of the woods here down in New Mexico, guys. Again, don't forget these at-home COVID tests literally are in, pretty outstanding supply at your local pharmacies, at your big box pharmacies. You can literally just go get these at-home COVID tests covered from your insurance. Obviously, call the pharmacy ahead if you have questions on how that works. But I mean, currently the state of Vermont and the Walgreens pharmacies over there are reporting that they are seeing increases in the number of Paxlovid prescriptions, aka the antiviral for COVID. More people sniffling and sick. So whether or not that makes its way all the way over here, one way or another, eventually we will hit our little, path of illness and just getting through that. A lot of people will either have some antibodies, be exposed, get it maybe once. Some people get it twice, 3 times in a season, but you don't want to go any sort of back to back with any of these, and you definitely don't want to have any of them, simultaneously. So what can people do to stay ahead of that? Definitely the flu shots are out in most pharmacies right now. Great idea to go and get one. Get ahead on that. Check out for local clinics or anything else that you might need to have a resource to get yourself a flu shot. So if it's your work does clinics, if you're, used to going to some community place to go do it, just check and see what the schedule is, get it all knocked out, get that one knocked out, reduce that chance for obviously getting the flu, passing it along to anybody else, and then, sticking up for your other anti-immunities that you want to build there, right? COVID, RSV. Adults over 60, 60 and above, you can get vaccinated for the RSV as of now. Young kids infants under the age of 8 months are going to be able to get vaxxed for the RSV vaccine here probably pretty soon. That one just did get FDA approved, so it's going to take a little bit of time for that to be fully rolled out. But adults over 60 can definitely go get their latest COVID boosters if they are due for the recommended booster or not. Right, guys, and everybody is at such a different point with these. It's at the point to make sure, just ask your provider, whether it's your pharmacy or whether it's your doctor, to just clarify where your status on the COVID vaccines are and if you need one. Correct, because a lot of people are in a lot of different places, and we do have children as well that are also in the mix. So because this episode is not necessarily going to get into the entire schedule of it all, and I don't necessarily think that's the purpose of today, I'm just increasing the awareness that COVID can easily be on its way back, and we are going to still need to be better prepared for it. Especially, we keep those levels a little bit, farther down here in New Mexico, and we will reap the benefits of all of that and all of that health. So let's do what we got to do. Be aware that the other side of the country, they are increasing in the amount of cases seen. Who knows if that came from overseas or where that comes from. Anyways, cool, guys. Let's talk about technology. And actually, our pharmacist frontline there did want to give a shout out to our sponsor of that, guys. Sponsors of our pharmacist frontline segment, that is PharmTrue. Guys, PharmTrue, more than just a pharmacy, it's a beacon of innovation and quality, providing pharmacist-formulated cannabis products since 2019. With a commitment to education and trusted, safe, well-designed solutions, PharmTrue is empowering wellness through community-driven healthcare. Join us, wink, wink, in our journey towards a healthier future backed by science and nature. Visit our website and definitely learn more. We'll take care of you guys. Very, very exciting. So, okay, Tech Talk segment. What are we talking about, guys? Interesting technology to note right now. This is some MIT news from this year. So I will share it with my screen on YouTube, Facebook, Twitter, guys. Pretty interesting. MIT news, a wearable ultrasound scanner could detect breast cancer earlier. So it's a little scanner that does attach to, like, the bra, which theoretically for, patients at higher risk for breast cancer can have like way more frequent testing. Like one of the biggest things when it comes to breast cancer, right, is detection. So where you're looking at the device, let me show you guys a little video here of this. Don't know if you will get much of the sound on it, but just see how it kind of works on there. There we go. It's inspired by honeycombs. So basically, this thing is super cool. I mean, it is literally a wearable ultrasound device, right? So it has all its different ways of changing and getting an early detection of breast cancer. So this is coming out of MIT, which is pretty cool. So basically, these MIT researchers have already started developing the technology, guys. As you see the form that it takes there and the way you can change the different angles to get the different scans. The benefits of that, correct, are right. Detecting breast cancer at the earliest stages, the survival rate is nearly 100%. Tumors detected in later stages, the rate drops to around 25%. So with those numbers there, I mean, it's a really cool piece of technology, especially when you look at, even think about like rural communities or communities out in Africa or anywhere like that, where you're not going to have, access to healthcare in the same ways. What can devices like these help do in, populations where healthcare access is not the same, where, right, that might be a situation to put in place. Like if you have a high familial history of breast cancer, well, if you hit a stage where you start becoming extra high risk, then the monitoring of, how that patch works, the wearable diagnostic is a very, very cool idea. So I think you guys kind of get what I was trying to suggest there. I mean, we still have to see the promise of it come out. I don't think this diagnostic wearable is something that's available for purchase right now, but, guys, finding a way to, attack and butt cancer once and for all, I want to commend a new technology that, is pushing for that, as we are looking to attack cancer with full spectrum oil cannabis right now and seeing how that can be a, positive thing through research and our own little butt cancer case study, 42 patient clinical trial. We are pushing on that, but like, look, this is awesome. You get some early detection in the right way, maybe make that technology even more accessible, more affordable, right? And that'd be very, very great idea. Early detection of breast cancer. Again, guys, you can be 100% chance of survival. So granted, I'm not going to be, your expert on every single particular type of cancer, guys, but where we can talk about is, advocacy, and this is what we can do. Where do pharmacists come in every single part of that? There's such specialized oncologist pharmacists that deal with cancer, especially those medications and the infusions and everything that has to do with that. So super cool wearable tech frontier. Shout out to the MIT program that's working on this, and we will continue to hope for high promise. All right, so next on our Enlightenment Hour, everybody, very exciting Enlightenment Hour brought to you guys by the Trichome Alliance. The Trichome Alliance, special shout out to the Trichome Alliance, our harmonious sponsor for the Community Spotlight. And excuse me, Enlightenment Hour. Join the Trichome Alliance at the Butt Cancer Gala on 9/21/23. That is a Thursday at Amador Live in downtown Las Cruces for an unforgettable Italian-style dinner and dinner play. Early bird tickets are $65 before August 31st, then $75. A password will be given to enter the exclusive gala, which is going to be a pretty unique experience for New Mexicans. So again, support their mission of advocacy, education, and community connections. Get your tickets at the Trichome Alliance's website to be a part of the extraordinary event. Cool, guys. So again, yes, I think we just talked a little bit about the butt cancer case study, and you guys probably have already heard me, talking about it. So I'm going to continue to talk about that. But that, ad is there for our show sponsor, the Trichome Alliance. Cool. So anyways, guys, talking about useful feedback. It's feedback versus praise. So again, this was looking at a study on how students flourish, right? But I thought this was pretty interesting about, teachers showing and highlighting how, students can be empowered. So not only how can you relate that to, hey, your life? How can you relate that to healthcare? How can you relate that to, your job or your family, right? So either way, how can you, actually do that, right? So the science behind here, this article found that useful feedback more than praise helps students to flourish. So again, as that makes, general amounts of sense, guys, I think we completely understand, but let's talk about and dive a little bit deeper into this. So again, think about the old Chinese proverb, right? Give a man a fish, feed him for a day, teach a man to fish, and you feed him for a lifetime. So again, right, how do you help somebody succeed independently, giving them the tools to do such things? How do you even check that for yourself? Do you have the tools to succeed independently? Do you know how to give yourself the tools that you need? So that's what we're talking about here in our Enlightenment Hour, guys. It's a food for thought. Again, so, take from it what you will, because what can you learn about, self-sufficiency and, success to those degrees? That is all very going to be internal and that sort of, type of work. But where can you help empower somebody to, be the best they can be? I think it's a great idea, right? What about not just correcting somebody's work? Correct. It's easy. The easy way out is to just, correct somebody's work or to do the job for somebody else, right? How do you do that without, taking somebody's opportunity to learn and grow and thrive away? And maybe the awareness of how people flourish should be accounted for in that. Right. So what does this study here take a look at? So I'm citing here a study from, excuse me, a study from Stanford, right? Basically, it's talking about how they explore the feedback, mechanism. And what they did here is they defined what's called agentic feedback, where teachers provide opportunities for students to independently revise their work. So that makes the student an active partner in the revision process rather than a passive recipient of feedback. So, interesting, Because you think of the case where, hey, well, maybe you want something done and somebody wants to, somebody, needs to hit a deadline, right? Well, how can you be better at helping somebody, hit that deadline on time versus, you know, just knowing that you're going to have to help them once the deadline is due. So, that's where you can take that proactive context of, feedback agency, right? So again, people come from different backgrounds as well, right? And to do a different, marginalized background sense, you've got to empower somebody to take the feedback again, revise independently, and go on their own to come up with the solution. And it sounds so cliche, correct? But where can you support that and empower that versus, babysit that, or, right? A lot of different things. Micromanage. How can you identify that with yourself? So check this out. When they were studying this agentic feedback, they started by collecting critiques, comments, and edits written by 139 middle and high school teachers from across the US. So what they did was distinguish between teacher comments and edits that provided more agency to students versus less. And we're like, what does that even mean? Let me show you here. So again, correcting spelling errors is not agentic feedback, right? That's not what you're looking for there. Telling a student that they need to reread the piece because there are multiple spelling errors throughout is agentic feedback. And as frustrating as that could be probably for the student and stuff, but actually being able to go in there and mindfully go and look at the work that needs to be fixed, what are you going to actually do? You're going to, right, learn how to create, teaching a man to fish, or, teaching a student. And, students learn better this way. So again, another illustration was rewriting students' topic and transitional sentences throughout the essays. Why would you rewrite that versus, putting in there, hey, a topic sentence this is what a topic sentence needs to do. A topic sentence tells you what is a paragraph about, right? Can you try actually reworking this, which empowers, right, the student, the trainee, the employee to do that. And so where you think about, hey, well, what could be my management style, or what is my learning style, or just my teaching style? Well, think about perhaps maybe the mindful types of feedback that you're able to give. Can you empower somebody to learn by giving agentic feedback? And defining that, right, is how to really support an entire community around you, especially with marginalized backgrounds. It's easy to maybe want to hit the numbers of, hey, you want to see this group succeed, or you want to see this, this task get done faster. So therefore, you just chop it up. But where are you doing a disservice to your students or your employees if you're not giving them that time to be able to do that? And at the same time, somebody that, thinking about that from the other end, thinking about your teachers and how teachers try to teach you or coach you, right? Where can you, take that feedback responsibly and do what you have to do to, adapt and grow. So that's all just worth thinking about and taking a deeper look on just the level as time goes, from just kind of hearing it, right? But very interesting. Teachers throughout, life come in very many different forms, guys. I think we see teachers through our parents. We see teachers through our political leaders. We see teachers through, scientists, through doctors, through, right, all kinds of different professions, every profession. Trade school students are being taught in trade school, right? A plumber is a teacher, right? So everything is a skill, everything can be taught. People are very receptive to learning skills that help them do things that they have to do. Maybe skill building is not quite the, you know, easiest thing for most human beings, and that's okay. But how can you be a better, more aware person to your own style of learning, and to, being mindful to somebody who actually is really helping you do what you got to do, versus you being codependent and expecting somebody to do something for you or help you. And same goes for the other side, right? The teacher, you cannot be, right, codependent and micromanage your team to those degrees, because you are not going to ever be able to have that capacity of letting go and letting them thrive. So a very happy, delicate balance and medium there, but a great way to present that through is through agentic feedback. Again, promoting somebody's growth. It's literally a proven way. So part of that communication, it's not necessarily explicitly saying, hey, well, I know you can do this. Like, do you have to say that? You can just literally say, hey, well, there is a choice here, right? Students think, people think, I'm given more independence, I have more work to do, but I get to choose how to move forward and use problem solving to find a path that works for me. So it makes sense. You give that agentic feedback, which is, offering more exploratory insight to helping that person solve their own problem versus solving somebody's problem for them. Gives you to the age-old add-in of teaching a man to fish versus, giving him fish, right? So again, feedback is a very, very important thing. It is how we learn. How can we give better feedback? How can we be better receivers of feedback to thus, be better at whatever it is that we are working on or developing or, doing. So, right, if you guys are into communication, which, I think most people probably effectively should be at that point, like, you have to learn how you identify with yourself so that you could communicate. You get feedback from your communication all the time through conversation, whether or not you realize if it's agentic feedback or not, that, maybe it's not going to be that way, but you may even give yourself that sort of feedback. So to be open-minded and, find those reasons to find answers in those, dimensions there, you can truly help to, control that ability to learn. And it's awesome, here in the state of New Mexico, where our education is very poor, right, compared to the rest of the states. I think, we're not looking at how to punish each other for that. And maybe it's easy to say, hey, look, well, we're having all these issues as a, community in terms of education. Well, we start hammering the drill on, make these grades, get this done without the context, but with just more volume. And that's not going to, create this system of, empowerment for our people that need to learn, our younger community or our college community. So feedback, agentic feedback, making and empowering people to grow and to learn. You can show this somebody that you have the belief in them without doing it for them. And science literally backs it up. It's not like a revolutionary thing, and it's cool. So moving on, guys, talking to you guys about cannabis today in our Herbal Wellness Corner, as we usually do. Very exciting. Looking at a study here when it comes to cannabis. Guys, our Herbal Wellness Corner is brought to you by High Horse Cannabis Company, and we want to honor them here. High Horse Cannabis Company as the trailblazers of the cannabis industry and proud sponsors of our Herbal Wellness Corner, with dispensaries in Chaparral, on Valley Drive in Las Cruces, and North Main Street and soon to be in Hobbs, New Mexico, High Horse is your go-to destination for quality cannabis products. Committed to professionalism, respect, and helping people, High Horse is changing lives for the better. Visit one of their locations and experience the High Horse difference. Check out High Horse's website and the future of cannabis today to shop their stores, guys. So jumping on into this, very interesting. Young people at the risk of psychosis symptoms surprisingly improved with marijuana use, says a study on marijuana movement. So again, I do want to talk about cannabis studies as a vacuum to a moment in time, because guys, we don't have the data to suggest the emotional ups and downs of the different outcomes from cannabis studies. But what we can do is talk about how are these studies interesting, how are they maybe going to prompt more questions, right? And something here that we really see is cannabis in youth and how does it affect the developing brain. We do have plenty of evidence for a lot of things here, but we don't have every single answer answered. So where you look at things like cannabis use disorder or psychosis associated with cannabis impairment or cannabis use, these are some of the things that you do worry about when we have our youth out there, perhaps possibly even using them. But it's just worth noting, what does that even why we've kept people safe, because we have to do what we have set out to do, right? And maybe there is room for cannabis to be an anti-inflammatory option for youth, or among other things in a medicinal value that could even replace some of the things that are already out there, your maybe antihistamines or corticosteroids, or any of the pain OTC stuff. You never know. We don't really have any of that full data yet, where kids might be popping all kinds of ibuprofen or NSAIDs, right, for practice, for sports, right, or things like that, where they maybe jump into opiates and these other things. So we, in that light, where can I look at the positive benefits of cannabis, show that light on them, guys? That's what we want to do with this segment here. So there's some, important things here talking about recreational cannabis use gaining considerable interest as an environmental risk factor that triggers the onset of psychosis. So these are things that, research is out to, at this point, honestly disprove, because the stigma out there, whether or not, research suggests one or the other, the stigma out there is going to support the fact that we associate, negative effects from cannabis use, especially heavy cannabis use. So when you look at recreational cannabis use, you're already putting it in a different category than, medical cannabis use. And, some people may categorize themselves as one or another, but may not even be fully aware of how that looks and where they even stand on the totem pole. And most people, may look at, hey, somebody's using cannabis recreationally, but they may not realize that that person might actually be using it medicinally. The person that's using it medicinally may not realize that they are using it medicinally. Maybe they are thinking, hey, well, I just want to use cannabis to uplift my mood. I don't have anything wrong with me. I don't need anything there to use it for. But, at the end of the day, is that of medicinal value at that point, right? Versus some sort of, potential for abuse or, a hazardous thing. So that's just interesting, because I will give you guys the pros and the cons and some other research here that kind of doesn't necessarily contradict, the latter here, but just showing kind of what that could be, because we talked about last week a little bit between cannabis intoxication and impairment, and then the next level above that is cannabis-induced psychotic disorder. So basically, again, the Cannabis-induced psychotic disorder symptoms here presenting as delusions or hallucinations. It could either be during cannabis withdrawal or during intoxication itself. Symptoms for cannabis-induced psychotic disorder are not necessarily just substance-induced. So, as we say, through withdrawal, you can induce that use disorder through not having it again. So what can that be, right? Delirium, delusion, hallucinations, significant distress, significant impairment. And where you're talking about all that impairment and neurocognitive motor functions and everything, you want, like, that sounds like pretty much the worst nightmare when it comes to cannabis use. So again, right, that can be a potential, is cannabis use, cannabis-induced psychotic disorder. And we are, of course, in big fear for that on a developing brain and what that could be. So what does that mean? Well, it means a lot of things, guys, because research doesn't really say one way or another. And this is not to tell our youth to, use cannabis at all. And we don't have enough research to suggest that by any means. But, what we do know is the brain does develop until, probably 24 years of age. And so to the very least, to empower, our youth to stay off of any sort of substances and let their brains develop the best that they can, eat healthy foods, fruits and vegetables, the whole 9 yards, of course. And then for the rest of everybody else who's also on the real train of this stuff gets out there and it's already in schools right now, as well as nicotine, we still have another, layer to completely unravel as we try to make sure and get, bring the forefront of the distinction between cannabis and nicotine and alcohol and opiates as a very, very separate conversation between each and every single one of those substances. So again, right, alcohol had medicinal value back in the 1800s until everybody was too drunk to do anything. And then, limited prohibition, now it's back as a recreational, use, where to some people you do use it for medicinal value, but right, we all kind of know that that's not necessarily the case there. You have nicotine, which also alcohol, nicotine, and right, opiates, all physically addictive. So nicotine, again, physically addictive, gets consumed in uncontrolled doses and through vape pens, through cigars, through right, the dips and everything like that. So what the nicotine does to the system in the body in terms of physical, addiction, and the process there of the upregulation is a lot different than, the nature of the healing effects of cannabis, right? And the way that the body is going to be physically addictive and what happens when you're not on it is a lot different than, cannabis. So again, opiates, same thing. Cannabis can help, bring down the opiate dose and help do pain control in combination with opiates, which is awesome. And we still want to reduce opiate doses by 25, 50, 75% with cannabis. But when we talk about, cannabis-induced psychosis, it's a different thing because the endocannabinoid system is in the body to, promote healing, to promote homeostasis through the means of inflammation, the regulation of neurotransmitters throughout the body. And where that system may be imbalanced, that is an avenue of where, humans do not have much knowledge right now. So maybe somebody's endocannabinoid system is imbalanced, leading to different particular health outcomes. Well, we can't really distinguish what that would be and how to fix it. Like, we have some ideas of, the entourage effect with, full spectrum oil cannabis and things like that. However, there's not much else that we have out there. And, maybe the withdrawal symptoms from cannabis could be underlying things that also, overlap. But again, where we do have cannabis-induced psychosis as a possible, side effect of cannabis that we want to address. Something there that you can look at is doses of CBD, right? CBD can actually help attenuate the, effects of THC, which could thus help bring down some of the delirium and the hallucinations there from, maybe a THC, overdose to some degree. But again, interestingly enough, now I'm going to report this study because I don't want to sit there and say study results by saying, making a claim to fame on one specific study and let's, study pump for a day. We're just going to talk about where studies, sit in the relationship to time periods. So interestingly enough, this one looked at continuous cannabis use over 2 years with 210 cannabis users from the ages of 12 to 15. They participated in what was an early detection and intervention for the prevention of psychosis program. So it was over the course of 2 years. Basically, the researchers were able to compare mental health and prescription medication usage of people who regularly consume cannabis to non-users. So interestingly enough, the study found that continuous cannabis use over 2 years of follow-up was not associated with an increased psychosis transition rate and did not worsen clinical symptoms, functioning levels, or overall neurocognition. Nevertheless, the findings of the study suggest that continuously using cannabis may be associated with slightly elevated, albeit non-significant, attenuated positive symptom levels related to non-users. So, this study showed that youth who continuously used cannabis had higher neurocognition and social functioning over time and decreased medication usage relative to non-users. So, right, interestingly enough, this is not a study that's here to say, hey, youth marijuana usage or youth cannabis usage is a thing, or even say that cannabis use can help prevent psychosis. All it's trying to do is, hey, well, we have the cannabis stigma that we are trying to look at, and where there actually may be, positive benefits in cannabis in youth, we can't even get to unraveling that until, right, we break down those stigmas and those walls. So interesting and cool. Something I wanted to shout out here for our community spotlight guys. Community spotlight talking about corporate tuition that recently New Mexico State University went ahead and improved a measure to establish this corporate tuition rate for companies that actually partner with NMSU's global campus and DACC. So interestingly enough, they're looking at a program for collaborating companies to be offering educational opportunities, obtaining skills and certifications in their skills with NMSU. So this is a pretty cool shout out to NMSU for, giving those opportunities for not only small business to, help build better workers and, fund their tuition, because, being able to make that a thing through the workplace is a very great opportunity. A lot of people do work and go to school, for employers to offer some sort of corporate tuition rate and help with that. Not only does it help more people go to school and get educated, right, but it also helps, our young people get more job experience. It helps our, small businesses get more help. All these different things that really tie into that. So I really do want to shout out to, right, NMSU for approving that corporate tuition, little deal there. And I think they're looking by 2025 to really get a good online university there at New Mexico State. And that's going to be just, really, really positive there for increasing that, education and trying to keep as much of the great talent here in our community as possible, because it's a lot of people go to school here and then take off and don't come back. So for that, let's make the most out of everybody that's here while they're here, and at the same time incentivize their ability to be able to come back, right? So cool. Shout out our Men's Health Minute, guys, brought to you guys by Vado Speedway Park. Men's Health Minute, ignite your excitement for Vado Speedway Park, our thrilling sponsor for the Men's Health Minute. Everybody, Fill the rest of it, the races with me this weekend. We are going to be having our bike night, giving away 131 bikes to entrants that come and draw. So it's going to be very cool, and we're exciting, guys. I will be obviously calling the races, and I'm excited to do all that too. So lastly, guys, going to go ahead and give a little bit of a reminder for our Men's Health Minute. What should we be doing, men, during our lifetime in terms of health checkups, right? Well, there's a lot. I'm going to share this in our chat here on our Facebook, YouTube, Twitch, Twitter, and it should be able to make it just fine. So again, what should men be thinking? Because, right, again, there's a pop quiz for men. What's your doctor's name? Yep, you heard me. Pop quiz for men. What's your doctor's name? Yep, that's a call because most men don't even have a doctor, right? Again, too many men. This is even from a MD from the guys. I'm giving you, information here from the University of North Carolina Men's Health Clinic here, and from one of their providers here. Too many men don't have a family physician and get regular checkups. This problem is especially bad for younger men. Again, so as we continue to talk about, right? Majority of men don't see a physician until they get sick or have significant problems in their 40s, 50s, or 60s. To some extent, it is a denial for the need of physicians. Again, part of the problem, if there's nothing wrong, you're not sick, right? You don't have to go in, but that's wrong. So what can that mean? Men, at all ages, right, should be getting checkups, heart health, vascular health. How is your blood pressure, cholesterol? What is your family history of heart disease? Are you guys looking at these things? What is risk-taking behavior looking like? Are you using substances or not? Right? Do you have depression, weight issues? Do we need to keep you up to date on your vaccines, right? Men with, weight issues could have also perhaps diabetes issues or potential for that. Other underlying things there, right, that slip in with the blood pressure and the cardiovascular risk, the risk for stroke, right? So in your 20s, men, you need to be talking to your doctors about heart health, checking that initially, and getting that, seeing where you are when you are in a good, healthy spot, right? Are you already at an elevated heart rate in your 20s? What can you do to, or, blood pressure in your 20s? What can you do to get that down for your 30s, right? Have you been screened for sexually transmitted diseases? Guys in your 20s. Again, in your 30s, men, doctors are looking even more into cardiovascular risk factors, right? Where can you set better lifestyle choices up to, age a little bit more gracefully? That's the perfect time to plant those seeds. Trying to avoid those things that maybe in your familial history you are already prone for, or do things to, right, help your risk. So again, men in their 30s, many men and women, right? People are raising families, dealing with careers in their 30s. So again, it's easy to be, overwhelmed, to feel all these things, to feel stress. So, people in this age group where we do have, families where we are, at the, height of the pursuit in our careers, a lot of people, right, are really trying to get a lot done in a very small window of time. It's a lot easier to, take that pressure and not know how to handle it. So, always keep that in mind. Again, men in your 40s, cardiovascular risk factors are way more important than they ever have been now at this point. Blood pressure, cholesterol, smoking, the other one. Smoking nicotine really increases that blood pressure, really increases that risk, that 5-year risk of, right, having a heart attack or stroke or a cardiovascular event. Again, also time of, life where erectile dysfunction can start. Many men don't talk about it with their doctor or even bring it up. So it's worth, keeping that all in the back of your pocket to know, that's part of your aging process and it can be treated and there's no reason to be embarrassed of it by any means, right? in 50s and 60s, men at this stage of life, right, all risk factors are now rising. Heart disease, cancer, prostate cancer becomes a real big apparent thing. Colon cancer, men in your 50s, you need to be getting those first colonoscopies at age of 50 and repeating every 10 years if you are at an average risk, right? If you have been a smoker over time, you should probably get a lung cancer screening in this age. Interestingly enough, in the men in their 50s and 60s, lung cancer is the biggest cause of cancer death. So something to look at. Again, screen for diabetes, weight control, and these things always are going to be high in the priority list, but still worth assessing. 70s and beyond, right? There is an aging process to start to discuss. And you look at your risk for, diabetes, you look at your, ability to maintain intimacy and how to continue to do that. And it's doable and achievable throughout that aging process. It's just, the screenings may have to change in frequency, right? Especially if risk factors are different. And, the monitoring may need to be a little different, and the ability to do the things that you did when you were younger may not be exactly the same, but, there's a lot of very, safe, positive ways to enjoy that without increasing any other risk. So continuing on to make sure that men actually do go to their doctor through their working age to the end of life. It's a big part of what we promote here on the Know Your Pharmacist Livestream, guys. So I think that's about it for today, unless we see any other questions or anything else. But I do see, good evening, and I hope everybody has a good night. We will talk to you guys tomorrow.